I just want to welcome you. Glad you're here for this presentation. We are going to get started. And as you know, this is an Intro to Sciatica Relief class. This is April 12th, 2025. So I don't like to waste people's time, but we are going to explain who this class is for. This class is for you if you're frustrated and feeling hopeless because you've not gotten the relief from the pain that you want and deserve. This is for you if you're feeling overwhelmed and overlooked and not taken seriously by those around you, meaning your doctors, families, friends. This is for you if you're heartsick from missing out on doing the things you love with the people who mean the most to you. This is for you if you finally want understanding as to why what you've been doing has not worked. This is for you if you're fed up with the lack of results of your care. This is for you if you've spent countless excruciating hours and way too much money on band-aid and dead-end treatments. This is for you if you want to take your life back. And this is for you if you are serious about getting real answers and relief. My goals for this class. Number one, I want to explain what sciatica is. I want to explain why most of the typical treatments do not work and why it is not your fault. I want to tell you about my three-step at-home sciatica treatment that's sweeping the nation and literally changing thousands of lives. And I want to give you a sense of hope and excitement that you can finally break free from this misery. So, who am I and why should you give an ear to me on this? Well, I'm a husband and father of two young men who are currently 30 and 32 years old. Been a physical therapist for over 33 years now. I'm an international sciatica relief expert. I'm founder of Sciatica Relief Now, and I literally wrote the book on sciatica relief. And most importantly, I am the best physical therapist in the world, according to my mother. Just wanted to show you some pictures of us and give you some background on me. I've been working in outpatient orthopedics and sports medicine since I graduated PT school in 1992. From 1993, a year after I graduated, to 2006, I was a PT clinical director both in Phoenix, Arizona, and then in 2004, when we moved to Charlotte, North Carolina, I took over and directed a clinic there. From 2006 to 2020, I owned three different clinic locations in the Charlotte, North Carolina area, and I opened a concierge mobile practice in Charleston, South Carolina, that I ran from 2017 to 2021. In May 2018, I founded Sciatica Relief Now, which is an online sciatica and piriformis syndrome relief service. And a few months ago, in January 2025, we moved back to Scottsdale, Arizona, where my wife and I got married and where we met. We moved from Santa Monica, California, due to the LA fires. But it really doesn't matter who I am because I'm not here for me. This webinar is about you. So before we get started, I would love to learn something about you. I want to know, what is that one thing that you are missing out on, that you're longing to get back to, but you're not able to do because of your sciatica that you guys are dealing with? Walking pain-free. Thank you, iPad Pro. Walking the dog, working out, going golfing, sleeping pain-free. I'd like to be able to go to my little boy's flag football games again, driving a truck. Awesome. That is awesome. I want to tell you a couple things here. Some things that some of my past clients have said that they've wanted to get back to. Here's Marcia Poole. She wanted to garden and get back into her yard this spring, and she did. This is Carrie Johnson. She wanted to get back to long distance running again, and she has. And this was one of my favorite when I spoke to Sean Balance. I talked to her May 12th. She started the program on May 15th. When we talked on May 12th, Shauna said, I want to be able to get on the floor with my grandkids. And I assured her that she would be able to. And like she says, I didn't have much faith, but in week 4 of Dean's program, I'm now walking a mile every other day. But most importantly, look at me today, playing on the floor with my grandson. I'm so thankful for Dean and his program and all the support here. What a blessing. That was one of the best things that, and most fulfilling things for me, being able to give something that they wanted. So before we jump in deep into this, in order to know how to get rid of sciatica, wouldn't it be great to know what the sciatic nerve is and what sciatica actually is? So you can see on this diagram, the sciatic nerve is made up of 5 different nerve roots that come out of the low back, which is L4, 5, which is lumbar level 4, lumbar level 5, along with sacrum level 1, 2, and 3. On the left-hand side of the screen, you can see the bones still in place. On the right-hand side, you can see here's L4 running down, L5 running down, S1, S2, and S3 all running down. And they create the thickest and longest nerve in the body. The sciatic nerve is about a medium-sized thumb circumference. And what it does, it runs down the back of the leg and it splits into 2 main nerves that innervate the bottom part of the leg. You have your common peroneal nerve, which runs around the front of your leg, and you have your tibial nerve, which runs down the back of the leg and then into the toes. So now that you know what the sciatic nerve is, we're going to just talk about what sciatica is. Now we're going to take you on a typical journey of a sciatica client. So what is sciatica? I know this is a run-on sentence coming up, but sciatica is any aggravation of the sciatic nerve that causes symptoms anywhere from the low back to the tips of your toes or anywhere along the nerve path. It can be in one specific spot. It can be in multiple areas. It can be all along the nerve path. It can be hit and miss all along the nerve path. So it is not just one area. It's not just one place. It can be all encompassing. It can be just in your ankle. It can be just behind your knee. It can be multiple places, and the symptoms can range from mild heaviness or tenseness to severe sharp electrical shock and anything in between. It can be numbness, it can be pain, it can be tingling, it can be a dull ache, a sharp ache. It can be so severe that you can't breathe type pain. It can send electrical light shocks. It can do any of those things. It can do all of those things, and it can change day to day. And I always tell clients, if your symptoms are changing and they're not consistent 100% of the time, it is awesome and it is beatable and treatable. So now what I want to do, I want to talk about the typical journey that most of my clients go through, but actually I'm starting to call it the typical insurance-based protocol journey that most people go through. Initially, when people start with some sciatica, they wind up Googling and trying to YouTube, okay, what do I do? How do I take care of this? Then they wind up either going to the ER or the AE, depending on where you're at, and go to their doctor, their PCP, their primary care physician, possibly get x-rays, but they're most likely going to get some type of anti-inflammatory muscle relaxer or pain relief medication, or a combination of all of them. Occasionally, you'll get a handout of exercises from your doctor, and if things don't change, maybe they'll change up some medications. They'll send you to physical therapy. If that doesn't work, you'll go to get an MRI to find out what's really going on, even though a lot of times an MRI is worthless for actually most of my clients. Once you get the MRI, you get referred to a specialist, an orthopedic or a neurosurgeon. And then you're trying to decide, okay, is it coming from the back, the piriformis muscle, the SI joint, the hip? Is it a muscle issue, a nerve issue? And you can go back and forth between specialists who don't necessarily want to treat you because they don't know what it is. And they get all these different kinds of diagnoses going on. And it gets more and more frustrating. They can change medications on you. You can get radiofrequency ablations and injections. I think a lot of you are probably relating to this as I'm going through it. You go along and maybe they'll send you to the same physical therapist again to get the same treatments all over again, or they'll send you to a different therapist who specializes more in what they believe your problem is. Or you try chiropractic massage, or you try some yoga and Pilates, the acupuncture, cupping, myofascial release, Egoscue, and hopefully you realize that I understand what you're going through. Then you got the miracle creams, the foam rollers, the TENS machines. 99% of the time, everyone that you see and everywhere that you go is all focused only on the painful areas, and they don't look at any other part of your body that makes up 90 to 99% of the rest of you that could be utilized to help relieve your symptoms. And that could be foreign to a lot of you. All of these treatments can leave you feeling depressed, overwhelmed, confused, fed up, frustrated, worn out, angry, helpless, hopeless, discouraged, and lost. Can anybody relate to that? I'm assuming if you're still here and you're on this listening to this, it makes sense. You're going, how in the world did you know that, Dean? Because basically, you know what? All of this insurance protocol trap that I call it, leads to chaos in your mind, chaos in your emotions, chaos in your symptoms, chaos in your life because you don't know where to turn. And it's frustrating. It's crazy, but it's frustrating. And all this chaos brings me to one massive issue that I have with medical providers is this. And being a medical provider, it's frustrating for me to see this. We tend to build dependence on us and our skills instead of empowering you to take control of your life. And obviously, as health professionals, we go into this profession to actually help people. So we don't intend to make you dependent on us, but that seems to be what happens rather quickly once we get into, and it's frustrating and overwhelming for most people. And I get it. So, like I said, it's not our intention to put you in this position and to put you dependent on us, but that is just what happens because sadly, that's what insurance pays for. That's what our companies can bill. And I hate it. I want to empower you to take control of your life. So, moving right along, my goal for every client, meaning you, is this. I want to create independence for you from needing me or anyone else to control your pain and your symptoms. I want to empower you to be in the driver's seat after you gain the understanding of my three-step simple common sense approach to healing. And it's kind of wild because it really is simple once you start down that path. All right. So if you've done any of these things, please type in yes. Medications, injections, physical therapy, chiropractic, Pilates, massage, acupuncture, decompression treatments, YouTube exercises, yoga, TENS machine. You just hoped it would get better on its own. Foam roller, inversion table, tennis ball, and surgery. That has covered pretty much everyone. Or do any of these exercises look familiar to you? And what these exercises are, and what I like to call them, are generic sciatica exercises, simply because these exercises are, you can get these anywhere on the web by typing in generic sciatica exercises. Isn't it sad that I just pulled up exercises that you were doing for your sciatica? I've never assessed you, I've never looked at you, but these are exercises that you were given by a professional. And it's really, really sad simply because they're generic. While I was a PT in Arizona before I moved to Charlotte, North Carolina, it was crazy that I found treatment pads that were made. I thought they were genius at the time. Here I go. If somebody has knee pain, if somebody has sciatica, all you have to do is pull out the pad of sciatica exercises and you would basically see these exercises on that. They have nothing to do with you specifically. Isn't that sad that you've been given exercises that have nothing to do with you specifically, but everybody gets those same exercises? It's wild to me that I used to think this was okay. I thought I was doing my clients a favor by giving them the greatest sciatica exercises, but you guys are all here. You've all seen these exercises. You all have done these exercises, and guess what? They didn't do much for you, did they? I want to talk to you about here's why these exercises and all the treatments that you've done so far have not worked and why it is not your fault. It really isn't your fault because you were just doing what you were told. And basically, all these treatment approaches, all these exercises are what I like to call temporary, band aid, and potentially harmful approaches and harmful things for you because they ignore the entire rest of your body that's not in pain as they focus only on the area of pain. And just to repeat, here are some of those temporary or band-aid approaches and fixes that you've either been told to do or given by your doctor. The pain relief creams, the hot pack, cold pack, 10 unit injections, pain medications, anti-inflammatory medications, muscle relaxers, got manipulation, massages, getting a lot of stretches to the painful side of the body, and all the attention is given to the painful side of your body. That is why it is not your fault. You're just doing what you've been told. And how is it, most people ask me, Dean, how is it that I can actually feel a little bit better for a while, but then the pain either moves to a new area or it just comes back with a vengeance? And that's so many of my clients and former clients' complaints. It's like, wait a second, I did get some temporary relief, so why isn't it lasting longer? And the reason it isn't lasting longer is this. If you had soreness on one side of your head and the doctor said, all right, the soreness is on the right side of your head, I want you to pound on the right side of your head 25 times, 5 times a day, come back in 2 weeks and tell me how you feel. Most people would say that's absolutely crazy. Why in the world would you want to do that? And my question is, and the thing about it is, if you pound on the right side of your head where it's painful 25 times, by the end of the pounding, it's really going to be painful even more so. But when you stop, you're going to feel a little bit of relief because you're not pounding it anymore. But what happens 5, 10, 20 minutes later? Just like your sciatica, it comes back with a vengeance because you're focusing on that painful side that has all the area and the irritation and the inflammation that's going on. So, after doing PT the normal way for nearly 15 to 17 years, and really the normal way means insurance driven protocols because that's all we know, that's how we're trained. We follow what the insurance company tells us, just like the doctor is following the standard protocol. Well, you can't get the MRI until you have 2, 3, 4 weeks of physical therapy. And if that fails, then they may want to do an injection before they even do an MRI. Most people, when they're in the MRI machine themselves, they don't have pain because of the position they're in. Yet, when they get the MRI results, they're told that the reason you have the pain is this or that, whatever the reason may be. But isn't it wild that you probably didn't have that same pain when you got the picture taken? So, really, is that the problem? But after doing PT the normal way for years, I realized that we medical professionals can be tunnel visioned and make mistakes. And the result is some bad advice and therefore bad results. I focused all my efforts on the affected, painful side of the body. Lots of stretches, lots of trying to strengthening and stabilizing. I didn't take into account the entire rest of the body. I didn't take it in account how your body's compensating for that pain. I didn't often consider the imbalances throughout the body outside of the area of the pain simply because I was so tunnel visioned and focused like so many of my colleagues are. So let's talk about what happens when you have pain. Number one, your body naturally compensates for that pain. And I always use the example of somebody walking on a sprained ankle. You've seen that person walking around with their shoulders bobbing and weaving, trying to avoid the pain, but your body's compensating. Number one, it's stabilizing the area where the problem is. And then what happens is the rest of your body's compensating so that you can continue to function with as minimal pain as possible, as hard as that is to believe. It doesn't feel like it's as minimal pain as possible, but your body is actually trying to minimize the pain for you. These compensations cause your body to be out of balance, right side versus left side. These imbalances cause a natural extra tension and stress inside your body. So if you think about that person walking around on a badly sprained ankle, their head, neck, and shoulders are bobbing and weaving. And what that does, it causes an imbalance in your shoulder muscles, your arm muscles, your back muscles, your leg muscles, and it causes extra tension and stress. And guess where all that extra tension and stress gets absorbed the most? It's felt in the areas of the body of pain that are already in protection mode and tightened, and it causes that area to be tightened anymore. Does that make sense? When you're in pain, your body compensates. When it compensates, it throws the normal right side, left side balance out of kilter. So you have extra tension in your body, and you already have an area of your body in pain that's already tightened down to protect it. So now what's happening is that area that's tightened and protected, and in my example, the ankle area, that bottom part of the leg is now absorbing all that extra stress and tension that it doesn't have the ability to relax, release, have normal blood flow, normal nerve conduction. And guess what happens? It delays and can even stop healing from occurring. So that's why when you are focused only on the area of pain in your body, and you're not focusing on these imbalances and all this extra tension, it stands to reason that the treatment is not going to work. So that leaves us with this question. And the question I had for years: why do the vast majority of healthcare providers and other professionals focus their treatments either directly on that affected primary area of pain or most of it on that primary area pain? And let me tell you, it's because that's how we are taught. Number one reason, we're taught to focus on that area because that's where you need the relief. Number two, sadly, follow the money. That's what insurance pays for. And I say that grimacing because once I started treating patients away from their pain, I started getting calls from the different insurance companies saying, Dean, you're treating somebody with right-sided sciatica. Why are you working on their shoulders and their left leg? And my response was always, are your clients complaining or are you complaining? No, I'm complaining. The insurance doesn't want to pay for you working on areas that are not the area of pain. And I said, well, if you've noticed, my clients aren't coming back as often to me because their symptoms are getting relieved faster. Don't you care that your clients are getting better faster, meaning they're happier? Number two, you should be happier because it's less money for you. But sadly, they weren't. They wanted me to stick to their protocols. So I had to start dropping insurance companies because they wouldn't pay for the care that I was giving their clients who are getting better faster, who are happier and returning to life more quickly than they had in the past. So why are we treating these areas? Number one, that's how we're taught. Number two, that's how insurance pays. Number three, most of us don't know any better. I mean, I was like that for the first 15 to 16 years of my career. I had great intentions. I wanted the best outcomes for treatments for my clients, and I just focused on the area of pain so much, especially where sciatica was concerned, that I left probably 75 to 80% of my clients being treated too long, not getting the relief that they wanted, or maybe getting that temporary relief. They go out to their car, they drive home, and by the next morning, all their symptoms are back, which is probably what most of you experience if you experience relief at all. So, my question is, are you ready to learn about the new treatment approach for sciatica relief that I have been perfecting for the past 17 years? I've had the privilege of using this new treatment approach with clients who are chronic pain sufferers. Here's Annie. She suffered for 40 years. Here's Christine. First time in 16 years that she has had zero pain. For people who are thinking it's too good to be true, you can see Brenda Wilson. Quite frankly, I thought he was a quack and just trying to take people's money. She's probably 50% better. That was just after our initial phone call. Johnny Allen, one of my favorite clients. He wrote, I found this group. This was my Facebook group after 4 years of nonstop back pain, 4 back surgeries, 2 hip surgeries, and literally wanting to kill myself. I wanted it to be over. I followed Dean's stuff since January 2020. This was several years ago, obviously, and since late March. So in 2 months, I'm walking, standing, working, living, and enjoying life. And more importantly, after being on painkillers for over 4 years, yes, I became an addict. I've been off painkillers since April 6th. So within 4 months of working with our protocol, you may be skeptical like I was, but I will be 100%. I will 100% back his routines. And Jennifer, I'm not going to lie, I was skeptical that Dean Volk could actually help me remotely. I can honestly say I'm seeing some relief and can work more comfortably as I am diligent with my stretches. I've also been able to help people who have tried everything. Here is Brenda Martin. She did chiropractic, massage, PT, nothing worked. At this point, she was 6 months pain-free. Now she's been, I believe it's 3 to 4 years pain-free. Here's Tina. I can honestly say that after 3 years of pain, I no longer have pain on my right side. This was after countless doctor's appointments, physical therapy, therapeutic massage, chiropractic visits, acupuncture, steroidal, spinal injections, and nothing helped. Here's Amy Vinicki. She was dealing with this for over 10 years. She had had injections, PT, yoga, massage, and medication. She had lost any hope that her situation would change, and she actually did a phenomenal video testimonial for me. I also had worked with people who thought it would get better on its own or it just wanted to figure out themselves. Margaret was a member of my group for a long time, really stubborn and independent, thought she could figure it out on her own. She finally gave in and did a consult. Seriously, she felt so much better than she had in ages. Here's Zach. He was a bricklayer, a masonry worker. He wanted to do it all on his own because it would take him a while to warm up. He'd feel great. Started working with us and did phenomenal. It was great working with him. I've also had people who were depressed, anxious, and fearful. Here was Carrie Johnson. I believe we talked about her getting back to her running. She was at one of the lowest points of her life a year after her fall and injury. Here's Andy. You, my friend, are the magic man. So much appreciation and many thanks for giving me my life back. A week ago tomorrow, I was contemplating ending everything. And she literally was. She shared with me and shared publicly that her mom had taken her life from sciatica years before, and now she understood it. Darlene Wilson was sharing how she was very depressed. August 19th, during a very depressing time of her life, she was in pain 24/7. Now I can tell you that Darlene is back to doing BMX biking. She has multiple properties that she cleans. All this to say, this is not my first rodeo. You would not be my first client. I am intimately familiar with the transformational process It's one that I understand intimately. And once you understand it, and once I show you the step-by-step process, and you can understand what to do with some training, you will be able to get back that pain-free life that you want, you need, and deserve. So, what is this new treatment approach that I'm talking about? First of all, it's not a trendy new treatment approach because I've been working on it and perfecting this approach for nearly 17 years. First in my clinics that I owned, and then since being online. I'm not going to give you some magic pill or exercise because basically there is no such thing. So if you are thinking that it's going to be a 1 or 2 step process, I'm so sorry. I can't and I don't promise results without you having to be an active participant in the process. And what energizes me and what thrills me is it's when that light bulb goes on when you start realizing that you can take control of your own pain and you can start winning these battles, and you are going to have to be an active participant. I'm the place where people turn to when they are tired of trying everything else that didn't work and are ready to feel and experience sustainable pain relief once and for all. So, what does this approach work for? Obviously, we're talking about sciatica, but sciatica, as you know, is merely a symptom. It is not really a real diagnosis. So, this approach works for piriformis syndrome, degenerative disc disease, bulging disc, herniated disc, spinal stenosis, spondylolisthesis, anteriorlisthesis, bone spurs, inflamed gluteal muscles or tendons, scar tissue issues, misaligned pelvises, rotated pelvises, leg length discrepancies, hip bursitis, ischial bursitis, SI joint dysfunction and instability, gluteal tendinopathy, hamstring tendinosis, failed back surgeries, facet joint arthritis and arthrosis, or chronic back pain. It sounds extensive, but you would be shocked at how many people come to me with 4 or 5 of these diagnoses at once. So, you ready to learn my secrets for your success? Let's get into it. Real simply, I have a 3 simple-step approach, and my success rate with clients since I've gone online since 2018 has been 95 to 97%. All right. Step 1, you have to balance out the imbalances in your body first. Remember, we talked about the compensations causing imbalances. If you don't take care of the imbalances, guess what's going to happen? Your body's going to be stressed and tense. You might get rid of the symptoms temporarily. It can be, you might get rid of the symptoms for a year or two, but guess what happens over time if you don't balance out the imbalances? The stress and the tension is going to overtake things and it's going to come back. Most of my clients are repeat offenders as far as sciatica goes, and they get progressive problems that seem each episode to either last longer, be more intense, radiate further, and it's much more complicated to fix it each and every time. And that's because it comes back again and again because your body's not in balance. Your pain has not gone away because you have not balanced out your body correctly. Step 2, you got to restore normal pain-free motion, or in this step 2 is what I like to say, you want to be nearly pain-free before you start stabilizing your body. You've heard how you got to get your core strong, you got to strengthen your glute muscles. But here's my question. If your glute muscles are weak, and if your core is weak, but your body's out of balance, can you really get an accurate testing of how strong your muscles are? You really can't. So I do not stabilize until your body is balanced and mostly pain-free. Step number 3, once we balance you and stabilize you, then we get you back to returning to your activities wisely. We want to give your body a chance to readjust to normal away from all those compensations before returning to all your desired activities. It's sort of like, I like to explain, I hadn't worked out for years when we moved to Santa Monica back in 2021. And I joined a gym that did 30-minute HIIT workouts. And it was with a trainer and about 8 people in a room where each person had their own square area to work out in. And being the prideful male that I wasn't going to let these older guys, younger guys, older women, and younger women show me up. So the first 30-minute workout, I did 30 minutes straight out of the gate, no build up to 30 minutes. And I felt great. although I was fatigued at the end, actually, I was wiped out at the end of it. I thought I was going to have a cardiac arrest, but I went home that day thinking, okay, I did 30-minute workout. That's pretty awesome. But what happened the next morning when I tried to wake up, or when I did wake up and try to get out of bed, I was so sore, and I was sore all over my body. I couldn't tell you which exercise caused it because I did everything all at once and I didn't build up slowly. So in the same way as that goes, that's what I like to do with my clients. I don't want you going back to the gym doing your full workout the first time because you'll never know if you aggravate your sciatica, which exercise, which movement, which rep caused it. We want to get you back into doing things slowly and wisely. So here is Dean's way of ending pain in an overall picture. We want to use your body to heal itself naturally and holistically. We want to balance and align the body first. We do things what I like to call active resting to release what is aggravated, irritated, and painful. And sometimes now, instead of saying active rest, I always tell people you want to treat your sciatica as an open wound. Why, with an open wound, would you dig on it, stretch on it, press on it, move around it, take the muscles around it, and try to cause the muscles around it to pull on it to stabilize when it's an open wound because it's not going to heal. And what I do, we want to work what's comfortable in your body to release the tension in your body to balance out the imbalances and put your body in an optimal position to heal. This may sound confusing, but what I'm going to do, I'm going to go over this step by step and explain how the system works. Obviously, we can't go over, and I'm not going to give you a full program just because this is an introduction to sciatica relief. It's not an all-inclusive, all right, we're going to teach you everything you need to know, but I am going to give you the overall picture. So hopefully you know what to look for when you're looking for a provider, whether it's me or not is irrelevant. You need to find somebody who's going to balance out your body first before they get you strengthening and before they get you back to activity. So let's go over step by step. Step one, we want to balance out the imbalances in your body. Your pain, your problem is persisting because your body is out of balance. And what we want to do, we want to get your body back in balance because balance really is the key to life. Everything in moderation. If your whole body is off, if your shoulder tension is imbalanced, right side versus left side, that will affect your upper back, which will affect your low back, which you better believe will affect your sciatica. So think of it like this. If the foundation or your starting point is off, you're going to continue to experience reoccurring problems and pain for years to come. You have to fix what is uneven first. And in the picture, you see a house that has a crooked foundation. You know what's going to happen? The walls that are normally perpendicular are going to have extra stress in the middle of them as they're aggravated or as they're at an angle. And the middle section of those walls are going to start to bow. Now, how much sense would it make to take another piece of drywall, pound it on there to reinforce what's already bowing? But that's what we're doing when we are working the painful side of our body. We're reinforcing the pain. We're hitting it where it's aggravated, and we're not really aligning or putting back into balance the problem. So if you put that piece of drywall up again, it's going to be stable for a while before the stress on that wall gives in again. The big problem for us compared to the house, our bodies don't come with a home and a body warranty. This is why for many of you, sciatica is either a repetitive issue or a never-ending issue because you're not taking care of the imbalances first. Okay? So how do we balance out initially? We stop stretching and irritating what's already irritated, that painful side. Because if we can balance out the imbalances throughout the body, it will decrease that abnormal stress and tension that we talked about. It'll put the body in an ideal position to heal. And then we can start focusing on what's hurting. But I'm going to give you a little secret. If you balance out your body properly, you're probably not going to have to focus on what's hurting because the area that's hurting will calm down because it's not stressed, it's not in tension. The part of the body that was hurting before will be more balanced and less pain. So, what kind of exercises and stretches are they? They're stretches and exercises that I've fine-tuned specifically to balance out the imbalances in your body which will give you rapid pain relief. And the best part is it can all be done from the comfort of your own home. You don't need equipment. You need a chair. You can use a chair. You can use your bed. You can use a couch. You can use the floor. Very, very simple. These are not exercises that are going to be like Zumba or running on the beach or something that most people think of when you think of exercises, but they will be simple and exactly what your body needs to make the most progress in the shortest amount of time. And that's because I'm going to be training you how to test for your imbalances. You are going to be the one that decides which side of your body you're going to exercise because you're going to decide which movement, which position is more comfortable, and you're going to avoid those things that are aggravating and stressful, and you're going to focus on what is comfortable and easy. I just want to talk about a few of my clients who have started my 3-step program. Here in the top left, Brooke, she said, great so far. I've been doing the first 2 exercises and already feel so much better. Here's Danica from the Philippines. She had her surgery scheduled. It was her last option. And then she heard of me. We spoke. She got into the program and voila, it's been 2 years. She didn't have the surgery. She's been doing great. Here's Arlene. Dean has gotten me from being unable to walk and taking 800 milligrams of ibuprofen and 4 aspirin every 4 hours to just take the edge off 7 weeks ago to being 90% better, able to walk fully upright, not taking ibuprofen except at bedtime. She's been doing the exercises 6 to 8 times a day. And people go, oh my gosh, you got to exercise that much. When you learn the approach, that would be 5 to 7 minutes at a time. So it's not overwhelming. Dana, I'm about a month in and I'm amazed. I went from pain level at a 10 to now a 1. Dean's course works and I'm a believer. And Donna Rada said, I still find it absolutely unbelievable and I hardly heard after only 3 days. People have wide ranges of experiences. I can go on and on and on like I am right now. Sometimes it takes people a couple of weeks. What we're finding is most people get 50% relief within 3 to 5 weeks and 90% relief by the time they're done with an 8-week program, which is one of my full programs, but that's not required for anybody and everybody. But I just wanted to show you how many people, and I could go on with hundreds and hundreds more, but I just wanted to show you it's not just a couple people. Some of these people, their lives were turned upside down, and I saved the best for last. One of my clients, Brooke, she said, I'm pretty sure Dean Volk is my Yoda. I had a consult with him, just a couple exercises that I showed her, and I've approved 30%, and she took the program and has now been 100% for a long time. And I responded to her, hard to feel the pain now is. Anyway, hopefully that gives you an idea of the testimonials of what we can do. And these are just people who started the program. And here is honestly my first online client back from 2018. This is Shonda. She says, honestly, I was very skeptical. I can tell you that Dean helped me more in less than 2 minutes. And that was less than 2 minutes of exercises that she did. Then 4 months of a chiropractor, then 2 doctors, 2.5 weeks of physical therapy. I didn't believe it could be that easy, but I was wrong. I'm excited where I might be 2 weeks from now, but please, I don't make any guarantees or promises that 1 exercise or 2 exercises are going to make the biggest difference. But I can tell you that when you start applying these principles and doing the right exercises consistently, you will have significant relief and you will be overjoyed. And honestly, the longest standing client that I've helped who had sciatica was a gentleman named, so sorry, I can't remember his name, but he had dealt with sciatica for 63 years. And after 5 exercises, he called me up so ecstatic. I actually got him on a video. He said, it's been over 60 years and I walked around my neighborhood today for the first time pain-free and I don't know how long. So I'm committed to your program. And so what I like to always do is just say, hey, it's right now commitment time. Don't be scared. You don't have to commit to anything. But here's what I like to ask people. I want to know, does everyone understand why addressing the painful part of your body before getting the rest of your body in balance has been the reason for your continued issues? Is that sort of drilled in to your head right now? If the reason for your continued problems, a lot of it has to do with the lack of balance in your body. So I want everybody here to commit to at least keeping an open mind to trying exercises or stretches only on the non-painful side. And I want to give a caveat to that. It's not necessarily the non-painful side that's going to fix you. It could be actually for my wife when she had her first serious bout, it was fixing her and balancing out her arm lifts and her shoulders, whether it was straight out in front of her or out to the side. When we found an imbalance in her shoulders and we fixed it, her sciatica symptoms decreased by 50%. So don't just think, Dean's full of crap. I stretched my good leg, my non sciatica leg, and it didn't hurt. There can be way more imbalances in your body than just the specific opposite side. So, step two, we get your body balanced. Step two is restoring normal pain free motion because we need you to be pain free or nearly pain free before we start stabilizing your body. And you don't need to look like any of these people, maybe the person at the end with their arm raised on the beach. But obviously, those first two are just there to show people, some people are just hypermobile and they can move way beyond and not have the serious problems that a lot of us had. And what I like to tell people, a huge mistake often made is this. We attempt to improve our core strength or core stabilization and our muscle weakness while the body is still in pain, meaning that your body's compensating and it's out of balance. Why? If there still is pain and the body's compensating for that pain, there's no way to accurately assess muscle strength because your body is not imbalanced and it's stressed and therefore it's not functioning normally. So naturally, your muscles will not be as strong as they would be as if you were balanced. Plus, I always add, why would you want to stabilize your body in a painful position? Why would you want to reinforce that those abnormal muscle patterns? I do not allow my clients to start stabilizing their core or other weak muscles until their bodies are balanced and they have relatively pain-free motions and they have minimal to no symptoms remaining. And even then, I start slowly and I avoid stressing the affected body part. And what's crazy is in the same way that we balance out the imbalances with movement and pain and discomfort, I balance out your strength by working the parts of your body that are stronger and more stable. And then we reassess to see what happens to the parts of the body that are weaker. And it blows people's minds that they actually increase their strength by working the stronger side of your body. So, step one, we balance out the body. Number two, we stabilize your body after we get your movement improved. Step three, we return you to activities wisely so that we give your body a chance to readjust to normal activities before returning to all your desired activities. We do it slowly and steadily because we do not want you flaring up, because if you flare up, it's going to cause pain, which you know now is going to cause compensations and cause your body to be out of balance. So we want to stay in balance as much as possible. So, Dean's tried and tested ladder of success. First, we restore your balance. Then we restore your mobility. We improve your stability. Then you can return to activity. We fine tune episodically. All right. That is what I do. That's how I do it. And here's some questions you can ask yourself. What am I missing out on by not getting this fixed? What would being pain-free mean to me? What value would it bring to my life if I got rid of this now? What do I want my life to look like 6 months down the line, 8 months down the line? What happens if I continue on what I've been doing? And for most of my clients, when they answer those questions honestly, it's a no-brainer. They want to find somebody who can balance them out or teach them how to balance themselves out, then restore their stabilization and then get them back to going. So what have we covered so far? Real simply, my 3-step approach: balancing out your body, stabilizing your body, returning you to your normal activities. So overall, basically at this point, you've got 2 choices. Number one, you can keep doing what you've been doing. And if you're here and you're still listening to me, I'm assuming you're not happy with what you're doing. And it probably means you're not getting the desired results that you deserve and that you desire. Or number two, you can get it done right, being coached and directed by someone that has done this successfully over and over and who's perfected this new treatment approach for the last 17 years. I mean, hey, I would love it if all of you would work with me, but I'm not that ridiculous to think that everybody will? Because you know what? If you can find somebody locally, by all means, please do it. That would be awesome. But if you want to work with me, I would welcome it in a heartbeat. I love working with people. This is what I do. And I've seen it all and have dedicated my life to making sure you no longer have to suffer. I say this is my passion. My wife says, no, it's actually your obsession. I just wanted to share Marcia's story here real quickly. What a difference a year can make. Exactly a year ago this week, I had had piriformis syndrome and sciatica pain at an 8 to 10 pain every day for the previous 6 months, plus lower back pain for over 5 years. And after she wrote this, she said, actually, Dean, my college days, which were nearly 40 years ago, I noticed I had back issues and I never equated it to this, but I now realize that those aggravating back pains that I've had for over 40 years are also gone. But here she's saying I was barely mobile, discouraged, basically non functional. My life was on hold. Sitting and driving were the worst. My doctor sent me for an MRI to a neurologist for nerve testing, then to a neurosurgeon who encouraged me to try other treatments before surgery. I had 3 steroid injections, a radiofrequency ablation, went to the chiropractor for 7 months, PT for 2 months. It all helped some. Pain went down to about a six. Then I heard an interview with Dean Volk, and I was intrigued by his unique approach. I found him on Facebook, did a 30-minute video consult with him, signed up for his 21-week course, or which is now my 8-week course. I'm on week 20 right now, which was 12 back then. And now my pain is a 0 to 1. I'm so looking forward to my pain-free future. She's the one who earlier, what she wanted to get back to was gardening and just living her life normally. And now she is. We keep in contact on occasion. It's been fun to watch her. So my question is, does it bring a smile to your face as you just think about the possibilities of what it will be like once you're finally able to beat this? And lastly, can you imagine what it would be like not to have to miss out on another girls' night out, not to miss out on going on the floor with your kids or grandkids, or simply going for your walk with a family, or driving your truck painfully, or getting back to golfing, or riding your horse? Do you remember what it was like to do what you wanted to do without the fear of paying for it later in terms of back, butt, and leg pain? Your time is now. It's time to start your transformation.